This is the lecture on related services, part 2. We have just finished transportation, and now we are talking about speech and language pathology. Speech and language pathology, or speech and language therapy, is the most frequently requested related service, primarily because language is so closely related to education. Now, any student eligible for special education may receive speech and language therapy if he or she needs the service to benefit from special education. Special education students, students with special needs, do not need to be identified for special education under the special education eligibility criteria for speech and language impairment in order to receive speech and language therapy as a related service. So let's talk about speech and language therapy. Okay, first, it's the most frequently requested related service. A number of children receive speech and language therapy, speech and language pathology, primarily because it is so closely related to education. Any student classified with one of the 13 disabilities under IDEA is eligible to receive speech and language therapy as a special education service, as a related service. So you don't have to be classified with a speech and language impairment in order to receive speech language therapy. For instance, many students with autism will receive speech language therapy. Students with learning disabilities could receive speech language therapy. A child with cerebral palsy under an orthopedic impairment, children with other health impairments, numerous different types of disabilities. Children with disabilities can receive speech and language therapy as a related service, even though they're not classified under the category of speech and language impairment. The next special education related services is psychological and counseling services. And this is something that you probably are very aware of. In-school, individual, or group counseling is a related service to help children with issues pertaining to school-related issues. Now, let me be very clear about that. We use psychological and counseling services to address school-related issues, all right? It is not the role in special education to be giving children individual psychotherapy. That's not the purpose. We give kids counseling. Sometimes it's individual counseling, sometimes it's group counseling, but we focus on school-related services directly related to the issues pertaining to special education. If a child needs more intensive type of therapy, we would make a referral out so that the child would get his or her own private therapist outside of school. But psychological and counseling services are available as a related services for students with special needs. You'll often see children with emotional and behavioral disorders, children with autism, or children with any kind of behavioral related issues that are receiving psychological and counseling services on their IEPs. Occupational and physical therapy is a related service. Now, occupational and physical therapy are both separate. Okay. Occupational and physical therapy address students' motor issues, okay, motor type issues. The difference is that physical therapy, or PT, addresses what we call gross motor functioning in general. Normally, gross motor functioning is addressed through physical therapy. For example, running, walking, throwing, catching, jumping, the really gross motor type functions. While occupational therapy deals with motor functions, but is considered more of the fine motor function. For example, writing, holding a pencil, drawing, buttoning, zipping clothes, those types of fine motor things, the grasping of things, the pincer of the pencil. Those are fine motor, that's occupational therapy. So a child could receive OT and PT or one or the other. But occupational and physical therapy are both related services and often quite common for children with motor issues, in particular those children with orthopedic impairments who have difficulties with motor-related issues such as cerebral palsy, spina bifida, or other types of disabilities where motor concerns are at issue. The next related service is known as orientation and mobility services. Now, orientation and mobility services are very specific. They are services that enable students with visual impairments to move safely within the school, home, and community environment. Orientation and mobility services include teaching students concepts and techniques such as the use of a cane and low vision aids. So let's talk about this. When you have a child with a visual impairment, or let's say a child who is blind, that child is going to need a great deal of help learning how to orient him or herself within the environment, how to get around the environment. And that child's going to need special services, the related service of orientation and mobility service, to teach the child how to move safely around the school, how to move safely around his or her home, or how to move safely around the community. And this could be learning how to use a cane, learning how to use a low vision aid. So children with visual impairments will often have orientation and mobility services on their IEPs to help teach them how to get around the environment because of the difficulties that they have with seeing and basically moving around the environment safely. Medical services. Now, medical services as a related service is not what it sounds like. Okay, let me be very clear. Medical services are not what they may sound like here. Medical services are provided by a licensed physician to determine a child's medically related disability that results in a child's need for special education and related services. Medical services under IDEA are limited to that necessary for evaluation and diagnostic purposes. Let me repeat that. Medical services under the law are limited to evaluation and diagnosis. The regulation by its own term limits the medical services for diagnosis. So for example, let's suppose a school district makes a recommendation that a child needs a neurological evaluation, or a child needs a psychiatric evaluation, or a child needs an orthopedic evaluation to determine the need for special education and related services. So the school says, you know what, Mr. and Mrs. Jones, we have a concern that your child may be in need of special education and related services, and we think the child should get a neurological examination. The school district is going to pay for that examination. Or if the child needs a psychiatric evaluation to determine whether or not psychiatric medication or a psychiatric diagnosis is warranted. This is evaluation and diagnosis, and that is a medical service. So again, medical services are provided by a licensed physician, and they are strictly for special education related services that are looking at diagnosis, evaluation and diagnosis. So it has to be by a licensed physician, and it's strictly for medically related evaluations and diagnoses. Again, think when a school district pays for a neurological exam or a psychiatric exam or some type of orthopedic exam, that is to determine the need for special education and related services, and it's strictly for evaluation and diagnosis. This ends the lecture on related services for part 2. You can move on to part 3 of the related services lecture, which will begin with what we call school health services.